Dr. Leah, a woman in her mid-20s, writes, I love my partner, but almost every time I have sex, I get a UTI afterward. Is there anything I can do to prevent this?
Well, you can blame it on anatomy, which makes a UTI more likely for women than men. The urethra is a tube through which urine exits the body from the bladder. And women, this tube is short, making it quicker and easier for bacteria to enter the opening and infiltrate the bladder. The bacteria that cause a UTI live in the area around the anus. Sex can shift that bacteria toward the front, so it's incredibly important not to go from anal sex to regular sex. And if he's stimulating you anally, you don't want those hands back around the vagina. Other reasons you might get recurrent UTIs can be having a new partner, especially one who doesn't have perfect hygiene. UTIs can be caused by bacteria on the base of the penis. Urinate promptly after sex, and this might help flush your bacteria out of your system, although the data on this is really mixed. Make sure that you always clean your genital and anal areas, especially before sex. Also, wiping front to back is a good practice, but it doesn't necessarily prevent UTIs because most women aren't wiping after a bowel movement and bringing the toilet paper all the way up front. And bacteria cannot migrate all the way to the urethra on its own. Stay hydrated, and drinking plenty of water does help. Avoiding urine after sex can theoretically flush the bacteria out, but like I said before, the efficacy of this just doesn't quite hold up in research. Scientific literature has failed to show any association between recurrent UTIs and urinating patterns before or after intercourse. But clearly, there's no harm in urinating after sex. And even though peeing right after sex might not necessarily be as crucial as we once thought, peeing regularly is a great idea to prevent infections when bacteria gets in the bladder. Also, try using a vaginal lubricant because friction during sex can irritate the urethra. Consider some drugstore supplements like probiotics, which have been linked to improvements in UTIs, and concentrated cranberry pills, which can create an acidic environment that minimizes the colonization of the bad bacteria. You should also avoid having intercourse when you're having an active urinary tract infection. Once you get on antibiotics, ask your doctor when the right time to resume sexual activity would be.